Hello everyone, my name is Dr. Chinozek, also known as Benny Blaze. I'm a medical doctor, physiotherapist, and content creator. Today I want to share with us one or two findings I discovered. Well, it's more like part of a research that was shared with us in a seminar. It has to do with male infertility. Um, for some time now, of over the years, it's been a concern about why there's been a lot of emphasis on male infertility, and we have noticed that there's so much attention or so much talk over the female aspect of it, because most times the female is one that goes through all the various tests. She's one that runs around from one hospital to the other, from one religious organization to the other, or ministry. And you now come to understand that, you now come to realize that many of those times, the person that is actually at fault is the male. So when you realize that, when it comes becomes an issue like this, is very pertinent. It becomes pertinent that we the healthcare providers, lend our voice to what is actually going on. Personally, I have my way in terms of what I how my approach. In as much as, yes, there's a standardized approach of it, but then there's a way I approach it. Most times, I'm always very, very conscious of the sociological aspects of these healthcare concerns. We know right from school, from our training, that 40% of reasons for infertility is on the male side, and then for the other 40% for the female. Then the other 20% is of unknown causes. However, a lot of things have led to the fact that it could be more than that, like in practice. And many times these people tend to hide under the fact that, that the males, that you do not question them, that you do not ask them certain questions, to um, put the woman through so much stress, through so much pain, in terms of looking for in terms of trying to conceive. You see situations in church whereby they'll ask for women that are looking for the fruit of the womb. The women are the ones that actually come out. Interestingly, what if the person that you are praying for, the seed, which is actually coming from the man, is not even alive? It's not even working, or it's not even viable in terms of being able to fertilize the woman, the ovum that is from the woman, or whether there is even a case of erectile dysfunction or premature ejaculation, other health issues that are preventing the man from being able to impregnate a woman, or being able to attain sexual satisfaction with his wife. So it's an anomaly even in the religious setting. So that's why it's important for us to keep speaking about this thing. But I noticed that also, in terms of that aspect, some churches have actually improved whenever such calls are being made for prayers, that the males are also asked to accompany their wives. So they are praying for both for the spouses, not just for the women. And it's a very good thing. A lot of churches have actually adopted them. However, it still becomes a very major issue that some people just emphasize so much on the woman, not knowing or not recognizing the fact that a lot of issues now are actually come from the men. You have not witnessed cases whereby the man didn't say anything about his sexual, or his sexual organ, and then only for us to discover that he was the one that is at fault. It's either he's not having an erection, or he's impotent, or it's a lot of all those things. So that is why we need to, those of us in the healthcare system, or those of us that are actually in provision of healthcare, to lend our voice towards this. Number one, I from the webinar I told you about, it was noted that in terms of development of the embryo, that the sperm plays an essential role in embryo development. So it's that the embryo, for an embryo to develop very well, it's essential that the the man's sperm is viable. Now, it's also important that there should be concern. The same way concern is raised for the woman, the same way concern is raised for the, it's also the same way concern should be raised for the woman, irrespective of the fact that the man, even if the man has given birth previous times, the clerking or the investigation should also not exclude him. It should not exclude him, because We've also come to notice that previous previous impregnation of the man does not exclude or does not spare him from a possible case of infertility. And this is also part where a lot of our healthcare providers are not really meeting up, because the patriarchal nature of the society has made it that people now, even in the process of clerking, normally when a woman when you go for when two people that are trying to conceive, you go there. Okay, they say, okay, you perform some investigation, pregnancy test, and then you tell the woman to do a scan or hysterogram, sorry, hysterogram, HSD. Um, you actually have to, they focus so much on her. Okay, she's do this one, she do that one. Yes, your uncle will say he's not coming, or you see later, we'll talk later, or you comes later. You ask him some questions, you just, but we also, one of the things that we were being made to understand is that it's important to probe in terms of past sexual history, past medical history, past social history, because, and also occupation. Occupation plays a role in all these things. A lot of people, tanker drivers, people who work in chemical factories, a lot of all these people are already risk factors to male infertility. So it's very important for a comprehensive clarity to be done on his own side. This is why we have actually, I felt the need to share this someone share this finding. While we are at it, it's very important for us to for me to reiterate the fact that some of these issues are more sociological than medical. It's either the man does not want to reveal of his previous experience and wants to lord it over the woman has to. Then the other woman also has to play a part. Like, we cannot just make this thing such a way that she cannot talk or she is not able to assert right over some things. Because you cannot put someone's daughter through the stress of having to go from one hospital to the other, having to travel from one place to the other. Then you are not actually solving the problem. You have not even made efforts to solve the problem. It should go both ways. I always tell them, even personally, when I ask for they come for investigation, I always try to probe into um, what the man is going through. Now, let me give you an example. I had a case whereby there's this lady that came in. She I think she was already pregnant, but she had she had an infection. So she's quite young. I think probably in her early 20s. So I asked about her marital status. She now told me that she was married, but then the husband left her with the parents and is outside the country. I think one of these Asian countries. And so while he's there, so she had this issue. So I was like, okay, I now asked for that. And I said, okay, what does she do for a living? She now said she's not doing anything. I said, that is a problem on his own. But meanwhile, let's leave that one on the side. That you're supposed that this man now that you're talking about, where he is, you don't know what he's doing over there. So and I said, okay, is there any plan to bring you over? She now said yes, that he said it's later in the year. That's when she puts to bed. That's when he's going to take. And I said, well, is that really his reason? Because she was just probably, I think, a few months pregnant, so she could travel, and then while the man is there, okay, I asked, okay, has the man done any investigation with respect to what is going on? Because apparently, I want to assume that he is the only one you have met. She now said, yes. She now said that when she asked him, he said that where he is, that he doesn't have any problem, that they run all those things. And I said that I don't agree with that. That she should please, when next he comes back, she should insist that he should run some tests, investigation, urine and all those culture, or and other viral tests and all that before she has any sexual relationship with him. That she's actually putting herself at risk. That no matter what happens now, she's one that is going to go through a lot of stress. That she's one that is going to feel the pain and feel the burden of it will be more on her. So that also, in addition to that, she should also try to find something doing, get herself busy with something, because she needs to be economically empowered. So now, many times, so that's when I look at when some people write on social media and they think I don't, I support this. I don't. I actually speak against them. However, I'm not a human rights activist. I'm a medical doctor, and also I'm not any of the isms or is. I just believe that there should be fairness. There should be fairness. There should be balance in things. So it doesn't make sense that a woman is a young lady. She's there at work and she's not doing anything. She's not. Employed or doing at least something to sustain her. How can she get married? It's not like they even finish all the right. I think they just did some introduction and no, not the introduction. I think they paid the bride price, but I think they've not done any ceremony. But then she stays with the man's parents. And I said, Madam, you have to be empowered. Are you? Because that's why with the process of asking, I asked her whether she was in school. She said no. Do you have any plans of going to school? She said that she wants to learn some trade and all that. But there is a limit to what I can do. The only thing I can do is to actually um, maybe sometimes go out of my way, but then that is not within my scope of practice. I can do that maybe as from my own chinwa and charity, my charitable charitable causes. But then as a medical doctor, that is not what I'm supposed to do. My own is to offer direction, information, education, and possible treatment depending on what patient provides presents with. So this is a concern, and there are a lot of ladies like that, and some of them, when they come with something similar, I always emphasize the aspect of getting self-empowerment or getting empowered financially, getting empowered economically, because that is actually part of all these issues we're talking about is all about economic empowerment. If a lot of women are economically empowered, it will make it difficult for them to accept some of the things they accept today. If they're economically empowered, it will also affect the kind of choices they make. It means that there are some kind of people you cannot settle for, but some of them actually settle for anybody, provided the person can provide some money or provided the person has something in his bank account. So you discover that the imbalance in the society of okay, the man is this, the man is that, then that's what's making the some of these people to make their decisions on this. Unfortunately, a lot of them actually turn out well badly, and it becomes a serious problem for them. So that is why I want to share this with us. So in a nutshell, what I can say is this: male in terms of infertility, the emphasis should be the male and the female should be to both of them should be involved in terms of trying to conceive, in terms of um trying to conceive, or if there's an issue with a case of infertility, two of them should be fully involved. Two, the male, the sperm actually plays a very big role in embryo development. So that is why it's essential for us to take to for men, because most times, like we also I also forgot to mention this part, that when the age as the age is gets older, the viability and the quality of the sperm reduces. So actually, so it's not only the females that are affected, and also the men is affected. I think from the age of 35 or so above, females, I think theirs. Okay, for females, I think theirs also starts from the age of 30, I guess, but because the peak of fertility is at 18 to 24. So from 24, it starts going estrogen and all those things. They start reducing, and it starts from the age of 30 and above. It starts getting quality of the ovum and all that. So the point is to okay, I've mentioned the 2 points down. Then the third part is everyone should be involved in this now. Our healthcare professionals should actually be more proactive in terms of clerking, in terms of investigation from the male side, because when you're talking only with emphasis, sometimes it's actually subconscious because of the way the structure of the society. So they subconsciously focus a lot on the woman having to do this and that. Okay, they hardly ask for seminar analysis because the man will not even be there. He will not come around. He will actually send the wife. So why will you see the person that will do the seminar analysis? Then there's also the case of some religious concerns about having, because for you to collect the sample of the semen, you have to do something. You have to stimulate yourself for you to be able to do that. There is no other way to get it. Because this means is actually the most effective. Any other means will not give you the result you're looking for. So you have to touch yourself, stimulate yourself for you to be able to get it. That is the way I'm going to say it. So it's also a concern. A lot of people have their own views about it, but the truth about it is that medically speaking, this is the way to get it, and you have to know it. Then I also have to point out the fact that in terms of marriage, these are things that need to be talked about. We emphasize so much about character, fine, which is good, but it's also so much about what the woman has to do, the standard she has to meet, what about the standard the man has to meet. What about when we remove money, what other things come up? When we remove the financial aspect, what about the other things come up? These are some of those things. These are some of the investigations that need to be carried out. So that we will not end up becoming enemies to ourselves, or we'll don't start creating an environment whereby there is animosity, and then there is no progress, or there is no that the marriage union or the particular union is not actually going the way it ought to. Then that is just the thing on it. I believe if there's any other points, if there are any things that need to be raised, we can always share it. We can always um, keep us updated on that. So once more, my name is Dr. Chinonzek, also known as Bethany Place. I'm a medical doctor, physiotherapist, and content creator. Thank you very much for being with me, and I look forward to sharing with you more on this health, the social aspects, lifestyle, personal transformation, mental health, and personal and other aspects. Let me just say, that's the thing. So thank you and God bless.